everyone, I am Dr. Shweta Goswami, Executive IVF Consultant at JP Hospital, Noida. Today I am going to speak about extended embryo transfer or blastocyst transfer in IVF. Is it really for everyone? So we need to understand the basic IVF concept that when we do an IVF, we give injections to the woman, we make extra eggs, we make supernumerary eggs, we take them out, fertilize with the husband's sperm, create embryos and put them back into the mother's womb, hoping to create a pregnancy in that way. Now when we talk about blastocyst transfer, it is something that leads to an increased success rate because the whole success rate of IVF depends upon good embryo selection. So once we've created embryos, we culture them in the lab. We can culture them in the lab for 2 days, for 3 days, or culture them for a maximum of 5 days before we transfer them back. Now when we take them to day 5, which is the blastocyst transfer, it is the day of the embryo at which it actually attaches to the mother's womb. So if we do a day 2, day 3 transfer, we have a 4-cell or an 8-cell embryo which may or may not develop into a blastocyst. And when we take them, all of them to blastocyst stage, then we know that whether these embryos are actually good, whether they have gone on further to develop into blastocyst stage or not. And that's how we decide which embryos are the best and therefore transfer them to get us a pregnancy. So if we routinely look at a day 2, day 3 transfer, we would routinely look at a 40-45% chance of success per embryo transfer, which would increase with a blastocyst transfer to about 60-65% in women who are young who have good ovarian reserve. The question, however important is, can we do it for everybody? Should we stop doing day 2, day 3 transfers and should we be doing only day 5 transfers? I think the answer is no, because the important thing in an IVF success is individualization. Do you as a patient, do you as a woman definitely need a blastocyst transfer and it will lead to a definite increase in pregnancy rate? The answer may not be no, may not definitely be yes. And the reason for that is that if we have lesser number of embryos to start with, if we have only 2 or 3 embryos, it might make sense to make. So the important thing to know is that day 5 may not work for everybody because we might be left at a stage where we may not have enough embryos to transfer, and we may be looking at a decrease in IVF success rate, because what is the logic of growing embryos further to day 5 if we have only fewer embryos to start with? So individualization is the key. We have to see whether it makes sense to everybody. It does just these flashy terms that we're doing blastocysts, we're doing laser assisted hatching may not really work for everybody, and that's what we need to understand. So if there is a patient who has about 8-10 good embryos and we need to decide which embryo to transfer, which embryo to freeze, and she's already suppose had a failed IVF where the day 2, day 3 transfer has not worked, a blastocyst definitely has a big role to play because it will help us decide which are the better embryos to transfer. Vis-a-vis, if there is a patient who has lesser number of embryos, they look good quality on day 2, day 3, and because there are only 2 or 3 embryos, it may not necessarily change anything. It does not help us decide which embryo to transfer. We would be transferring the same embryos on the day 3 of transfer. We'd probably be transferring the same on day 5, and therefore there's not really a much increased success rate. So the perceived increased success rate of blastocyst transfer may not happen. So that's an important concept I would want to convey, that we should just not get swayed away by flashy terms that this is what we do and this is what we do. It is for you as a person and for you as a patient and couple, what makes most sense is what should determine what should be your path of the IVF treatment, and not just adding things to the basket just because they look flashy to us. For any more details, you can visit our blogs on zevafertility.com, or you're free to text me at 9717 111 733. Thank you.